You welcome back again, and today on Health is Wealth we are going to look at a prostate, or what we call the prostate gland. The prostate gland is in the renal and the reproductive system. However much the prostate gland is under the endocrine system of the body, because under the endocrine system of the body is where the glands are, and glands are responsible for productions of the hormones that are responsible in managing the day-to-day duties of the body. So the gland itself is located in the male system. It is with the male creatures or men that do have the prostate gland. So specifically, this topic is to all men. And with prostate gland, it has become a major concern in the day-to-day life of men. So prostate gland is located in the pelvic region of the body of men, and it is in between the urinary bladder and the penis. We can say the prostate gland is in between, or is a joint of the bladder and the penis. But in between, before even that, the gland, the prostate gland, it is in a walnut shape, or we can say like a ring ball shape, and it is in between there. And if you want to feel it, we normally feel it from the rectum, because it is in front of the rectum, but in between the bladder and the penis. And what we should know, that the urethral line passes through the prostate gland. In between it, that's where the urethra passes. So this pipe of the urethra that brings the sperm or the urine out of the body passes in between the prostate gland. So what is the function of a prostate gland? The function of a prostate gland, one, is to regulate the passage of one fluid at a time in its due time. How? That if it is urine, the one passing, so the prostate gland will bring in hormones that will regulate the sperms to stop, so that only urine can pass. Or it regulates the sperms. It can, because it can allow the sperms to come, and then it blocks the system, the urinary system, whereby the urine to come out. So those two fluids cannot come at the same time. So it is the prostate gland producing those hormones that regulates the function of the urethral system, either the urine to pass or the sperm. Two, the prostate gland excretes the fluid that brings in the sperms together, what we call the semen, out. It helps in producing the fluid or semen that helps in transportation of the sperms, which helps in production. So those are the two major functions of the prostate gland. One, to regulate the usage of the urethra, either by the urine or by the sperm. Two, it produces the fluids or semens that helps in transportation of the sperms from the testosterone. So now, why has the prostate become a major concern? Because we've seen problems or diseases affecting the prostate. What are the major problems affecting the prostate? In majorly, we have three problems affecting the prostate. One is what we call prostatitis, the inflammation of the prostate. Two, we have what we call the enlargement of the prostate. Enlargement of the prostate is in majorly called what we call the BPH, the bioprotrophy hormones in there, causing it to enlarge in size. And the third one is what we call the prostate cancer. The cells that are cancerous affecting the prostate. And those concerns, they are affecting men in most cases. How can you identify that you have prostatitis or enlarged the prostate or you have prostate cancer? One, we have that downer pain in between the rectum and your testicles. That inner pain. If you feel that inner pain, you just know that you have a problem with your prostate, or you go for a medical advice, because it might be also another thing that might be, but majorly it's that. Two, if you have a problem in maturation, in urine, in urinating, either you cannot control your urine, or either it just comes out anytime, anywhere, that you don't have control on it. Low manpower or low libido. In most cases, if you have prostate cancer, your libido or sexual desire, or what we call erectile dysfunction, reduces. So with that, when you're doing tests, also we advise you to look for such. And what are some of the tests that you can take? We have what we call PSA, BPHA, and also the biopsy test, the prostate biopsy test. Those tests can help you determine those three problems that we've mentioned above: the prostatitis, enlargement, and also the prostate cancer. If you do those tests, they will help you to identify the problems of that. But also, we have other causative problems. As I've told you, if a person is an old age, they are most likely to get prostatitis. Those people who smoke a lot, they also have a problem of developing prostate cancer. Alcoholism, masturbation as a behavior or an addicted behavior also affects the prostate gland. Also, we have also other infections, such as these bacterial infections, making it to enlarge and what. And also, there is these emergencies or accident. If you get an accident and then you get a damage in between your bladder and the rectum, you tend to get a damage on the prostate. So if you get an accident, we also advise people that at least you go for some medical checkups or you consult a doctor. And what are some of the tests? As I've told you, you can do the PSA test, BPH test, the biopsy test, and also you can do the ultra scan, the pelvic region ultra scan, which can help you also detect if you have any prostatitis, inflammation, or enlargement. So with that, I hope you can do that. But the management of it is a bit technical. Apart from clinical trials of using medicine, injections, tablets, what and what, we have what we call the cancer therapy. As I've been explaining, that if you get prostate cancer, the only medication of prostate cancer is chemotherapy or radiotherapy. With that, it's the only way when the cancer cells can be burned out or treated from the body. So it is the only way. So if you get prostate cancer, the best advice is look for cancer institutes or cancer management institutions, and then you get. But for these other small issues, whereby you can go for surgical operation, also it will need the specialist for the endocrine system. But for clinical trials, you can consult the medical personnel and also keep your hygiene clean and also avoid such other behavior practices. And with that, I believe you can. Some men should be keen on that. If you see any pain, if you see any change in sexual desires or low libido, if you see that you cannot control your urine, it just goes out anyhowly, you have some problems like blood in urine, So I advise people, you do check up on your renal system, both from the kidney, from your urinary bladder, ureters, and then the prostate gland. Thank you very much. And that was all about our renal system.